Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes. With your host, Dr. Rhiann Windsor. Dr. Windsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she spent her career helping clinicians and care teams optimize patient outcomes. Health outcomes aren't shaped in exam rooms alone. They're shaped in neighborhoods, schools, housing developments, and communities. In part 2 of our conversation with Jessica Yanow, President and CEO of the Arizona Alliance for Community Health Centers, we explore the power of partnerships. From housing and public health collaborations to digital transformation and AI, this episode looks at how health centers are building relationships and leveraging technology to extend their impact beyond clinic walls.
So let's talk a little bit about partnerships and collaboration. Partnerships are becoming increasingly important. Where are you seeing promising collaborations, whether with housing, behavioral health, public health, schools, etc.?
So I think what I'm going to say is probably a non-answer, but I think it's really all of the above. It's across the board. We are needing to partner with all of these entities. The history is that health centers have always been deeply embedded in the communities they serve, and that they have developed these partnerships with other community organizations. Depending on the community, we are seeing partnerships with housing providers, with behavioral health, with schools, public health agencies, health plans, and none of that is new. I think the urgency has grown, and I think that there might be a different perspective around how urgent those other entities also feel it is to partner with us than maybe they did previously. And so I think, we talked about the Rural Health Transformation Fund. That was an opportunity to really elevate some of those partnerships and think about how we work together. Again, I don't know exactly what it's going to look like as the funding gets distributed in the state, but I think it's not an either or moment. It's an everything moment. And so I find too, even with, as there are policy and regulatory changes, working with other partners that we have in the state to navigate that, to express our concerns around it, to have those conversations so it's not just us saying that, I think is really important too. So I'm sorry it's a non-answer. I think I could go through a laundry list of this health center is doing this and that health center is doing that, but I think in the end it is a time where these partnerships are critical. The resources, as we know, have either been stable or shrinking, and we need to find new ways to do things. And any resources we can leverage are really important. We have a few health centers that are working to co-locate with public housing. And I think the idea of a community where there is housing, healthcare, education, all in one spot, that it's not an easy feat and it's not something that a health center can do alone. Kind of everything needs to align, including the municipality, to be able to do that. But that's something that's going on right now. The conversations we're having with health plans are evolving also around how we partner, as health plans start to realize also they are losing members as we are seeing the Medicaid rate decrease as well. And so again, that's not a very specific one, but just in general, knowing that they are thinking about those things too opens a door for conversation.
Absolutely. We had a guest recently on our podcast, Dr. O'Connor, and she's a orthopedic surgeon, but she is now focusing more on prevention in the musculoskeletal space, if you will. But she was talking about something that I thought was really interesting regarding there's really only 11% out of this 100% person that we see standing in front of us that we can really impact as healthcare providers, and shifting that focus to the community and to empower those individuals in the community to elicit behavior changes that, if we support our community, then we're going to see, the efforts of that as far as healthfulness of the community. Like, we can't get them to the appointment. I can't go pick up my patient, bring him to the appointment. I could, but it's probably frowned upon.
Depends if you're a health center, you might be able to. Yeah.
But how lifting up our heads and kind of looking out into the community and thinking about those things, I think, is critical.
Mm-hmm. It absolutely is. And, so much of your health outcomes are determined by the zip code in which you're born and live and work. And so the healthcare provider can only do so much. So it really is about those partnerships that address those non-medical factors that help improve outcomes as well as the clinical visit.
Yeah, and so a question I have is kind of around sustaining those partnerships. Mm-hmm. Do you partner and they stay, or is this a really kind of ever-changing landscape?
So what I would say about this work in general is that it is relational and not transactional. And so the intention is to have those conversations to build long-lasting relationships that ultimately help support partnerships, and those relationships still exist after whatever project you did together. And so sometimes it is just getting that cup of coffee or breakfast or lunch or whatever with that person and getting to know them and having a relationship where then you can call on them when something does come up. Because I think a lot of times every once in a while there is an opportunity. You see something, you're like, oh, we need to partner with this entity and here's how. But a lot of times it's more you develop these relationships and then an opportunity comes up and you already have this relationship to say, hey, I saw this thing and can we talk about whether this might be something we could do together? And so I think the intention, I understand sometimes things come up where it's like, we just need to work together on this right now. But the intention is really that you develop those relationships that outlast whatever that particular project is, and that then allow you to revisit project after project, to know about each other's kids and lives and whatever else. But I think, that's the sense that we're all in this work together. And I think that in terms of sustainability, I think that is really the way to do it. You'll apply for a grant and there will be questions about sustainability. And the reality is for many grant programs, they can't be supported if there aren't those dollars available. But if you have those relationships, sometimes you can figure out creative solutions.
Absolutely. I mean, we've talked about relationships in a lot of different facets in the exam room. And I found that to be true too when I first moved to Phoenix to start managing a surgical technology program. And I had no connections in Phoenix. And so the one girl that was still left in the program, she said, well, we have 20 students that were supposed to go to clinicals, but they never got placed. And I was like, okay. So that was my first job, was to start developing a rapport and relationships with my potential clinical sites. Go see them, sit with them, talk to them, let them know my face, and then once the student is there, continuing that relationship as well. And I did have one OR manager say, it's really nice that you didn't just dump the student on us and we never saw you again.
Right? Well, because the goal is that relationship.
Yeah. And I'm like, well, I'm hoping that you'll take another student moving forward, right. And here's some cookies, so it definitely, those relationships definitely make a difference. And
I think sometimes they're what sustains us too. Mm-hmm. So when we are going through a time where there are a lot of changes, to have somebody that you can call that maybe isn't doing your exact job, but that is also, experiencing maybe from a different perspective, but experiencing the same changes, and to be able to support each other, to be able to have conversation about what that looks like for each of you. I think that's really important too.
Me too. Just that connection and that brainstorming, like, hey, I might have this really crazy idea, but I'm going to bounce it off you and let me know like what you think about that. It is invaluable. Mm-hmm. For sure.
Well, and I think too, the more big brains you have around a table, the better the opportunities are, the better the ideas that come out of it. But you have to be open to having that engagement with people.
Absolutely. I love that. I think that just supports the idea we were talking about reducing burnout for ourselves as we're going through this, is calling on our own communities and our own support systems to really help carry us through as well.
So that's maybe something I would say too. We talked about provider burnout or staff burnout, but we're not really talking about CEOs of health centers, for example. And I think for me, there are, and I might have talked about this last time we were together, there are primary care associations throughout the country. Almost every state has one. I think there's 52 of them. And there might be 54. But those are my colleagues who are doing the same work in different states, and the environments differ. They're all dealing with the same stuff from the federal level, and the time I spend with those folks, even we have a monthly call that's an hour. We see each other in person periodically at meetings. It is invaluable. Invaluable both for the professional, the learning piece that has to do with the work, and also just for the support to we're not in this alone. And that's what I would say for health center CEOs too. I think we have a great cohort in Arizona. I know not every state has, I'm sure all health center CEOs are great in other states. I know in some states they don't have the same relationship that our Arizona health center CEOs have. And I think that is something to lean on too. When things are difficult, even when they're not, that you have that support of people in the state that are doing your job and get it, I think is so important. So I don't know. I already see people doing this all the time, so I don't think it's a call to action, but I think it's just a reminder, if you're a health center CEO, you are not alone. There are other people doing your work, and it is hard, and you should talk with them.
So we're going to shift gears again and talk a little bit about digital transformation, AI, those kinds of things. So all of these things, digital tools, digital innovation, telehealth, AI, there's new stuff coming at us every single second, it seems like. How do you see these technologies supporting health centers in the next few years? Or how do they even sift through all of this?
So there's a tremendous interest in use of AI, and many health centers are already using AI in some capacity, and the capacities differ. They have enormous potential to help health centers just in terms of the amount of manual work that providers have been doing, that staff have been doing, and really shifting that. So we're seeing advances already in documentation support, population health analytics, appointment optimization, patient communication, AI-supported triage and virtual collaboration that can help extend clinical capacity. But I think the goal has to always be to reduce burden, not to add to it. And I think the other piece is that no AI tool is perfect out of the box. It evolves, right? It has to learn from you. And so I think early on we had some experiences where health centers were like, this is just not going to work because the tools that they were using were not advancing as quickly as they wanted them to. That's really changed dramatically over the last couple of years. And so I think it's an exciting area that can really also support provider satisfaction. That's what we're hearing a lot too. But it takes some time as well for folks to learn to adopt the AI tools that might be part of their job responsibilities.
Yeah, definitely a learning curve there, and just an openness to investigating those possibilities and opportunities with the tools. I remember, this is a few years back, but my friend and I, we met for lunch. She is in a learning position with the Phoenix Water Company. And she said, oh my gosh, have you been using AI to develop your curriculum and your lesson plans? And I was like, no, that's cheating. And she's like, it's just a tool like anything else. And I was like, oh, I was not on board. And I ended up attending this 2-day conference that was all about AI and learning and how it could be leveraged. And that changed my whole way of thinking. One of my biggest takeaways I had was to remember that it should be human, AI, human.
Yes. Yes.
That's a big takeaway. And I was like, okay, it can make mistakes. We double check, but it can definitely be it's a tool that I use different AI tools every single day now, practically.
I think I was very much like you. I was very hesitant. And when my son was in high school, they were teaching them how to use AI responsibly. And I thought, I don't know why he needs to learn this. I don't want to do this. And then I've actually found, especially when I'm having a moment of writer's block, which I know is not necessarily what health center is using this for, if I can just get some kind of thoughts on paper, it'll craft something for me. And then I'll read it and I'll think, this is not at all how I would say this. But it got me past the writer's block to then completely rewrite it. Yes. But it is. You starts with you and what are you really trying to do? And then it helps. And then you need to be the human that's like, I would never use this word, or this doesn't sound right to me. But it makes such a huge difference, I think.
Does grandma know about AI? Or I think about what would my grandparents say if they were like alive right now? Like, it's so interesting.
Grandma?
My grandma was upset that she had to buy 4 tracks, 8 tracks, records, cassette tapes, CDs. She's like, I bought my music 5 times over in my lifetime.
Yes, I'm still upset about the tape collection I had to give away a number of years ago.
Oh, you shouldn't have given it away.
I know. My husband was like, it needs to go out of our house.
Be worth
and I'm
millions.
Sad. Yeah. We still have the CDs though. It is really interesting actually. My grandma, so she's 102, but she has always been an early adopter of technology. So she was an elementary school teacher. She was an elementary school principal. She has now her desktop computer is old at this point. She hasn't bought a new one in a while, but she uses the internet. She texts, she FaceTimes. And it has been really interesting. My son actually did a project for his senior year capstone in high school where he talked about her life through that century. And one of the things he talked to her about was technology. And so she talked about how technology had evolved from when she was born in 1924 to he interviewed her in, I guess, 2025. So really interesting stuff. But could we imagine it, like even now, I think some of the stuff that that was in the Jetsons now happens, and it seemed completely absurd then.
Yeah, absolutely. I would like to think that if my grandma was still alive right now, she would be an early adopter as well. She and my grandpa had the first electric washing machine.
Oh.
And their block. And she said all of her friends wanted to come over and like, can we see your washing machine? So I would like to think that she would be an early adopter too. But it's a really interesting time to be alive and in this field and seeing how things unfold.
Well, and I think because they evolve so rapidly too, I can only imagine what AI will be doing for us in 5 years, 10 years. Like, it's mind-blowing. But I think that's the other piece too, like the advances in technology keep speeding up.
Partnerships, innovation, and relationships are shaping how health centers adapt to a rapidly changing environment. In the final part of this series, we'll turn our focus toward long-term sustainability, leadership, and what the next chapter of community-based primary care could look like. Thanks for listening to The Exam Room.